I'm excited. Okay, so we hit the go live button and we're live, guys. So really excited about today's show. I've got a great panel. Those of you who are watching, we're glad you're here. We're going to talk about how to improve patient experience by focusing on our staff. I've got some great specialists here, panelists that are going to help us with this subject. Of course, we're going to lean on you too. So if you have some comments, things that you want to add to the discussion, things that resonate with you, please put that in the comments. Any questions you want to have of our panel, please do that as well. Let me do this. I want to allow each of them to introduce themselves. I'll just say who they are first, but I'm going to allow each of them to introduce themselves after I make the initial introduction to everyone on our panel today. So top left-hand corner, I have Miss Noelle Kohles. I have top right-hand corner, I have Miss Ronda Reid. I also have Pamela Lindemann, as well as Kym Ali and Casey Smith. So welcome to the show, everyone. And let's start off with you, Noelle. Tell us quickly, who are you in terms of like, what are you doing for a living and where do you work? How about that?
Hi, everyone. Thanks for tuning in and watching today. My name is Noelle Kohles. I am the Chief Nursing Officer and the Clinical Operations Officer for Greater New Bedford Community Health Center. And one of our focuses is exactly on the topic that we're talking about today. So I look forward to joining the group in this discussion.
Yes, go Rhonda.
Hello, I'm Ronda Reid. I am looking for a job right now. I have resigned from my position, but I have been a director over 3 ERs and absolutely love working with the staff and the ER. The ER is my main focus. So thank you for having me.
Awesome. And Pamela.
Hi, I'm Pam Lindemann. I am a registered respiratory therapist. I am also currently looking for different opportunities. I have been over respiratory therapy, neurodiagnostics, and sleep. And as I said, I'm currently out there shaking the bushes, seeing what we've got.
Love it.
Well, you know what? You're in the right set of bushes right here. We got a great community here, great support system. So those who are connecting, who are here, please connect with Pamela or Ronda or anyone on our panel. I think they're great folks to connect with. And who knows, maybe your next employer may be watching right now or maybe watching the replay. So very good. Applaud you guys for being here. And then Kym.
Yes, hi. Hello, everyone. First of all, happy Nurses Week. Today marks the first day of Nurses Week, so super excited about that. And my name is Kym. I am a registered nurse, and I am an entrepreneur. And I help healthcare facility retain staff by providing wellness to manage stress and burnout.
Awesome. And Mr. Casey Smith.
Hey, Ross. Hello, everybody. I'm Casey Smith. I'm Director of Nursing at one of the large academic hospitals here in the Texas Medical Center. And this is actually one of the primary things I do every day with rounding, communicating, and working with my staff to deliver great care to our patients, but also deliver great care to them during these times.
Mm-hmm. Awesome. Love it. And we've got lots of folks who are already piping in the comments. Hello, Dr. Rosina Malaska. Welcome. And we, of course, Noelle, she's already piped in. Joanne coming in, as well as Robert. Good to see you, Robert. Robert's here joining us. So, yes, please keep coming in with those comments. Let us know where you are in your journey. Feel free and add to our discussion in the comments and ask any questions you have. I would love to hear just kind of top of mind, what's kind of top of mind in your world. But before we do that, let me just ask one little question here. I want to ask the folks in the comments here, and let's all do this. What is the thing that's changed the most for you in the past year? I want you to answer that in the comments, folks who are watching. But Noelle, let's start off with you. First of all, what's changed the most for you in the past year? And then what's top of mind for you in terms of improving patient experience by focusing on staff?
Well, I think the biggest change for me this year was you. So you brought me out of the depths of hell and the hole that I was living in when I left my previous position, and literally brought me back to seeing the light and really showed me that, we've all gone through some tough times, but at the end of the day, your passion is your passion. And I love being a leader. I love helping patient and families. I love getting the staff to a place where they can function at the highest of their level, because that just gives back to the patient experience. So So thank you really for that. I hold you on a very high pedestal. And in the last 3 months, I've been working full time as the CNO of a health center, and it's been life-changing for me. And it's really been it brings nursing to a full 360 degrees. These nurses working at a community-based health center is exactly where it starts. These are the people that try to keep these patients and, the low, underprivileged socioeconomic, I was going to say company, but community around you out of the hospitals. And you don't realize that when you're in a hospital setting, how much them getting back to a safe place actually impacts where they go. So this has been such a great opportunity, and to work with staff that are like thirsty for change and thirsty to improve has been nothing short of amazing to me. So this is probably the happiest I've ever been, knowing that we're doing so much to change.
Wow.
Yeah.
You packed a lot in that comment. And I want to thank you.
So I say to my peers though, and I'm stealing your thunder for a second.
Sure.
So to Ronda and Pamela who are looking, it's enjoy your time, you do you, and take that time, because I had to take a step back from my position last May, and I chose not to work for probably 7 to 8 months before I started my nurse entrepreneur and then coming into this position. But you need that time to reflect, build your strength back up, and really land where you need to land, because everything I've ever wanted to do out of a job or wanted for my employees, I have now. And it's like winning the lottery. So I just give yourself time and be kind to yourself.
Absolutely.
Thank you.
Yeah.
Thank you.
Absolutely.
You're welcome.
In fact,
All right, Rollis, sorry, you can have it now.
Oh, you're good. You're good. Thank you for all those kind words. I literally feel joy, and this goes out for not only how I feel, but also how I feel about all the nurses. This is the start of Nurses Week, as well as respiratory therapists, because we have one great one here with us today. So I'm going to give a round of applause for those folks. This is how we feel, guys. All right, very good. So let's get back into our discussion here. Now, Kym, I know you've got to leave a little bit early, so I want to give you the next opportunity, and then we're going to go with the rest of our panel. But Kym, give us some tips on some self-care stuff we can do to help our nurses to stay in the game, respiratory therapists, all of those who are part of the patient care teams.
Sure, absolutely. Well, Noelle mentioned my first recommendation is to give yourself grace and show kindness to others. I believe a lot of nurses feel guilty for what happened during the pandemic. We were put in a morally compromising situation when it came to patient care. And you have to realize that no one knew what to do. I mean, the CDC didn't know what to do. The own president of the United States didn't know what to do. So give yourself grace. You did the best that you could do during a tough situation. And next is kindness. Be kind to others. You don't know what your colleagues are going through at work or at home. So just be kind, check up on loved ones. A next tip would be gratitude. Be appreciative for what you do have. There are people in this world who would give their arm and leg to be in a situation that you were in. So a lot of times I tend to write down daily one thing that I'm grateful for and just put it in a box. And then at the end of the week, go back and just reflect on everything that you're grateful for. And that will give you peace and clarity and make you realize that things aren't that bad. I do have some good things going on in my life, and it's not that bad.
Wow, I love that. Okay, that deserves this right here for sure. Let me get it right. There we go. Yeah. That was excellent. Thank you very much for that. Okay, so let's get into some tips here from you, Ronda, as well. What are your top tips? So we got some great self-care stuff from Kym, which I think is incredibly helpful for anybody who's watching. I mean, that was incredible. So Ronda, what do you have in terms of improving patient experience by focusing on staff? What would be your top tip on that?
Well, for me, patient experience is everything. That's the reason I go to work. Every day I come home, I count my blessings, the people that I were able to touch, but just not the patients, your employees. it has been a really hard year for our employees. Staff is asking to take more patients than they've had to in the past. They're scared. I remember when it all started and us trying to figure it out. How are we going to protect ourselves? And then there was a shortage and they're going, no, you can't wear a mask. And no, oh, now you have to wear a mask. And there was so much confusion. And then the staff started leaving for travel positions, and it's leaving us with a smaller number to work with. But our population's so sick, and those ones that stayed with us, I mean, I am just so grateful for. And so really just acknowledging them, loving on them. I know for me, I always have an open door policy. Don't have to make a meeting. My staff, I am open to, if the night needs to talk to me, I tell them, let me know beforehand and I will be here 5, 6 o'clock in the morning. I want to be here for you. They need to know that you're there. And then in the huddles, I believe in huddles 100%. And in those huddles, that's where you're going to bring that team together. That's where we put out our communications, but it's also where we acknowledge our staff, what they're doing. It's a time, I remember as a new nurse, my charge nurse coming in and yelling at us about our whiteboards not being done and you need to use ADET. And I came in feeling great, but I left that meeting feeling just so unappreciated and down. And so that's when I decided to be a director. I was like, I'm going to work my way up and I'm going to make a positive difference for nurses. And so in the morning huddles, make sure you go in, you're positive, you thank them, you welcome them with open arms, make sure they have time to talk to, because they may be struggling and you want to be there to listen to them, tell them what a great team they are, recognize them, and have them recognize one another. Now that we're fixing to start, hopefully the travel assignments are going to start going down. Hopefully COVID's going to be going down as everyone's getting vaccinated and we're starting to build our teams. I think it's really important at this time that we are patient for our patients and employees when hiring, that we're really looking at the people that we're going to be bringing into our teams. And that's what I'm excited about, making sure that they are positive, that they are want to be part of a team. Ask them, hey, how have you been part of a team? Always take them out and see how they interact with the employees, making sure they can keep up with me because I need them to work fast. And so being able to see the compassion and hear those manners, because that's something I can't teach. If you're a new nurse, I can teach you to be an ER nurse. I can't teach the manners and compassion. And then lastly, making sure your team interviews everyone that you're bringing in. I remember one time I loved this guy and I took him to the team and they came back and said no. And I'm like, oh my gosh, why not? And they went, do you know why he wants to leave? And I went, no. And they went, he's on an action plan. He's not going to work. And they said, we need our team members to make sure that they're here. Now, he didn't tell me that, but he told the people on the team that. And so it helped us. And I went, thank you so much. But you're showing your employees that you respect them, that you're hearing them. Absolutely. And so once your employees are feeling appreciated and valued, you're sending those thank you notes home to them. You're doing recognition for them, then your patients are going to start feeling the value. Because if the nurses aren't feeling valued and loved, then your patients aren't.
That's a great point. We've got quite a few comments came in. Rosina Malaska, Dr. Rosina Malaska, she says last year, oh, wow. She says meeting you, Rollis, last year, November, and being a part of your show has exposed me to much more. Being a frontline critical care nurse in this pandemic made me realize how much we all are struggling in a broken healthcare system whereby so many of the underserved and low socioeconomic status are hardest hit. We also have Rahul coming in from India. Welcome. Thank you for being here. And Yamini Balhag, thank you for being here as well. So huddles, I'm curious, what's your stance on huddles, Casey? Do you use those very much?
Yeah, so huddles are actually great. So it was funny when I was listening to Rhonda and Kym, because as Rhonda was saying with staff, we've actually elected to hire some student nurse interns because we're going to grow our own because it is a very tough market. So we actually operate in a huddle system, and I've just got off our tier 3, which is the executive huddle that we have every day before we came here. So your tier 1 is going to be with your staff members, just as Rhonda outlined. And then the issues from that is brought to a tier 2 that we have every morning, where you look at operational aspects and quality of care aspects for the facility. But then that's also where you're able to bring up, this has been broken 4 days. We put in the appropriate work order. However, I know that other director or VP is on there, and so my staff really needs this fixed today for XYZ reason. And so then you get results. And so the reason why I say that about the huddles and how it relates to Kym, how Kym was talking about putting one good thing that they're blessed for or grateful for in a box every day. I actually saw this with one of the student nurses, is drawing that line for them, for the intern, about how you bring these issues up and how it works through and it gets resolved. And she's in working with a patient who's recovering for COVID, and they have the weakness and this and that, and they're really depressed as the ladies were talking about, the challenges we're having with the patients. And so she said, okay, well, we're going to do this, and this is going to be like our huddles. And so she started relating how this person's going to have a goal. This is their huddle 1 goal, their huddle 2 goal, and their huddle 3 goal, and and working through that. I mean, it was really not only kind of innovative, but it was really kind of nice showing that, you're showing them and they're feeling some ownership, not only of that when they bring issues up, they can be addressed, and, they understand not everything can be fixed right away. Some is a process and you have to work on it. But there are other things that, you can have applications to as well. So it was really fun to go in there and watch them do that. And the tier 2 for the day was the person was going to be able to swing themselves to the side of the bed, pull them up on the side rails, and then touch their feet to the ground. And she was going to stand there with their knees and holding them so they wouldn't fall or they wouldn't slide. And so that was their little thing that they did for the day. So it was pretty neat. So when the gentleman's wife came in a little bit later, they were able to talk to him about that, talk to her about that. So, she was very happy, and he was happy because he is getting stronger. He's going to go to rehab and go home. The worst part's over for him. But it was just neat to be able to see how you can relate one thing that is for process and operational and for staff engagement, but how they can also take that, they can actually utilize that for their patient engagement as well.
Yeah, that's awesome. I love that. Okay, so from your standpoint, Pamela, I know I've been watching some of your videos recently. You've been talking about lots of cool little tips. What's your favorite one? The one you get the most response out of that you've given that we can share with our audience here today?
Well, the one that I got the most response from was probably the signs that I put in everybody's yard at the beginning of COVID.
Oh yeah.
I went to the marketing department and I asked them to help me find a vendor to make signs for my staff. I got the idea because it was right around graduation time and they were no longer going to have graduations. So I saw all these signs out in people's yard that said, here lives a graduate, class of 2020. And I thought, my staff needs to be recognized as well. So I got all the signs that say, a hero lives here, and it said respiratory therapist, and it had our hospital logo on it. So my husband and I went out and we snuck them in everybody's yard. Nobody knew that they were coming. So the ones that were getting off of work, we did those first so that they would see those. And then the ones that were working, then we went and we put those on there as well. And what was really cool about that is that Facebook, my staff started taking pictures of them with their signs and putting them on Facebook.
Nice.
And it was really, really cool that they, because let's be honest, not many people outside of healthcare workers know what a respiratory therapist is. Mm-hmm. And they didn't know until COVID hit. Yeah. And then all of a sudden, they all knew what we were and what we did. And they finally got some recognition. And my staff was just enamored by that. They just thought that was the coolest thing ever. And it was a lot of fun. Like I said, so that's the one thing that I've gotten the most response from with the videos and different things that I have done for my staff.
That's amazing.
I love that. I love that. So before COVID, a lot of people didn't know what a respiratory therapist did, but after COVID, they're like this right here. For sure. Okay, let me switch it back. No, that was great. Thank you for that. So in terms of, I got another question. I want to do some fun stuff here too. Okay, I have a fun question I want to ask all of you, then we'll get right back into our discussion here. So, guys, if you're just now jumping on, let us know where you're signing in from, and let us know where you are in your journey. We're talking about patient experience and how we can improve it by focusing on our staff. But I'm just going to diverge just for a little bit and ask a little fun question, okay? All right, so I'm going to ask. Let's start off with Kym. We're going to start off with you, Kym, because I know you have to leave a little early, so just in case. All right, so would you rather have a bionic eye or a bionic ear? I've asked this recently. I want to see what you guys say. What would you pick, a bionic eye or a bionic ear? And those are the comments. I want you to answer as well.
Yeah. I would have to say a bionic ear.
Okay.
Because I can eavesdrop on board meetings and hear all the good secrets to make more money.
Okay, I like that one. I like it. Okay, I'm going to go a circular motion, so I'm going to go down to Casey. Which one would you pick out of those two, a bionic ear or a bionic eye?
I think I want to have a bionic eye. I want to be like Steve Austin's $6 Million Man.
Oh,
Get
yes.
a bionic eye, not a bionic ear.
I think you just dated yourself there, Casey.
Reruns.
My mom, she sent me a picture not too long ago where she met Lee Majors at the mall here in Houston and took a picture with him.
Awesome.
Yeah. Okay, so Pamela, how about you? Which one would you pick?
Oh, I would pick an ear. I would pick because, you could hear, because I've always wanted to know what people were thinking.
Uh-huh. Uh-huh.
And so, if they're sitting over there and they're chatting and you see that eye dart to you, they're talking about you. I want to know what they're saying.
Very good.
I could read their lips with my bionic eye.
Yeah. Yes.
That's true too. You've got a good point there, Casey. And now Rosina, she says she's going to go with the bionic ear. Rosina, tell us why. Why do you want to go with it? And by the way, hello, Alex from Boston Medical Center is also joining us. Welcome. Appreciate you being here. Okay, Noelle, which one would you go with?
I am totally going to go with my friend Casey because right now I already have ears like a dog and I hear too much and I'm very sensitive. And with 4 kids, 2 dogs, and 5 cats, I'd rather see a lot.
Okay.
And to Casey's point, vision is everything, right? I feel like if you can read lips, I think of those that are hearing impaired too, you can still function exactly the same. And if I can see further than what my eyes can take me to, I'm going to go with bionic eyeballs.
Okay. Rhonda, how about you?
Oh, no doubt. I have bad vision, so mine would be an eye. I remember one of my CEOs one time told me, always come in with fresh eyes, because sometimes we forget, we see it so often that we don't always pick it up.
Yes.
And so if you have that good vision, you're seeing everything that patient's seeing. And to me, that would be the most beneficial for me.
Well said.
Wow, that was excellent. Okay, I want to see.
I know she just dropped the mic on all of us.
Yeah, she did.
Yeah.
I want to see what the audience says about that. Yep, they like it too. Very good, excellent.
No pressure, Pamela.
Ah.
You got to top Ronda now.
Okay, so did we get everybody? Did we get everybody's stuff? We got everybody on that one. Okay, all right. So my next question has to do with how do we increase engagement amongst care teams? And so the person who wants to answer first, you have to answer another question before you answer the real question. Oh, look at Casey. Casey's ready.
Oh, goodness, it didn't show up too well.
Oh, you know what?
This is what I'm showing you what we did for community as part of Nurses Week. You can't really see, but they're, maybe you can see this one.
See?
Yeah, I can see it.
Smiley face cookies.
Yeah.
We went and handed out to
I like that.
respiratory therapy and all the different departments that support nursing, happy face cookies. Because who can't be happy if you're eating a happy face cookie.
That's true. Put a smile on that face, right? Okay, so since you answered first, I have to ask you this. Would you rather have to learn to walk all over again or learn to write all over again?
Oh, probably learn to write.
Why is that?
Oh, it's I don't know. I've taken care of too many patients that can't get up and walk and all that sort of stuff versus just not being able to write. I'd rather be able to get up and move around, do that sort of stuff.
Yeah, makes sense. Kym, I know you got to run, so you want to pipe in on any one of those things before you head out?
Sure, absolutely. In terms of interdisciplinary teams, I believe just communicating more, finding out what is it that an individual needs to do their job successfully. What data do you need from me? How often should we communicate with each other? Do you want feedback? Those simple things which care teams need in order to do their job efficiently are critical, not only for them, but for patient safety and patient outcomes as well.
Very good. And then, so if you had to make a choice, would you want to have to learn to walk again or write again?
Right, because I barely write now. I type everything. So.
Okay. Okay, very good. Well, we're so glad you were here with us today. Whenever you have to jump off, you're welcome to do so. But thank you for being here. Appreciate all you do. In fact, I will give you just a quick before you head out. I got to give you one of these for being involved today. So thank you very much. By the way, before you head out, how should folks connect with you? What's the best way for folks to connect with you? On LinkedIn, or what's the best way to do it?
Yeah, I'm very active on LinkedIn. You can shoot me a DM, or my website is KymAli.com. KymAli.com,
very, very easy. But guys, that's KYM, KYMALI.com. So I don't know what they'll give to type the other one in. Let's make sure we type in the KYM, okay? All right, thanks again. Yeah. So Pamela.
Thank you guys. Pleasure meeting you.
Appreciate you. Thank you. So Pamela, since you're our lone person outside of the nurse world, so I want to ask you next, what's some ways that we can have some better coordination amongst the care teams between, let's say, respiratory therapists and nurses? Maybe if you could give us some advice on that, that'd be great.
Well, I think one of the things that we need to remember is that we're a team, and it's a team approach. It's not, this is my patient and I'm going to dictate to you how to do your work. Ask me. I've said this before, if you tell me to give a breathing treatment and you order me to give a breathing treatment, I will do it. But if you ask me to assess the patient and give my input, I will give you 50,000 times more help than, being told what to do. I want the nurses to understand that we went to college too. Sometimes, a lot of times, I appreciate that they take ownership of their patients, but there are patients too. And so when we all respect one another and we respect what we do for a living and what we bring to the table, you'll find that you'll get so much further with any discipline. And, I even have to tell my own staff sometimes, you have to remember that the nurses are looking out for that patient just as we are. One phrase that I've always told my staff, and it's kind of silly, but I said, don't be a busboy, because a busboy only takes things away from the table. Bring something to the table. So don't be a busboy. Bring something to the table.
Wow. That's pretty cool. I like that. Okay, so Noelle, I can tell you got something on this. Give us some. What were you thinking when you heard Pamela say that?
She just, I think, echoes what everybody is already thinking. Our respiratory therapists were like the glue that kept nursing together. If you build that partnership and that relationship with the nurses, oftentimes and that really goes to anything in life. You build that relationship and give somebody the value that they are and they deserve. They're likely going to do things without you asking them to be done. And, every nurse has their niche when they're a nurse. Mine was cardiac and respiratory. Respiratory is like my favorite thing to do. And I would work with the respiratory therapist to teach. There's so much about the respiratory system that if you're not working in an ICU, oftentimes nurses just don't learn and know. And when crisis happens, nurses sometimes will freeze and be like, where's my RT? Where's my RT? So much so, in one of the hospitals I worked with, we had a respiratory button and a code blue button.
Oh, wow.
You know, yes, that you hit respiratory if your emergency is respiratory. And you couldn't have said what you said any better, Pamela, because I think that people need to understand it is a give and take relationship. Everyone is there for the same reasons and everybody wants the same outcome. And that's to improve our patients, improve the experience, and, create a positive, healthy working environment.
Absolutely.
Yeah, very good. I got some comments that just came in. So Rosina, she says that because I'm always curious about what people are thinking and what's going on behind closed doors. That's why she said she wanted the bionic ear. So she agreed with what some of y'all said. And actually Joanne made a note of it. She says Kym was bionic ear, Casey was bionic eyes, Pam was bionic ear, Noelle was bionic eyes, and Ronda was bionic eyes. Okay, very good. So those of you who are watching, even if you watch the replay, if you're not watching this live, you're watching the replay, we still want to hear your answers. We're interested. We'll read the comments later. Oh, hey, here's Hugh. Hugh says we went into healthcare because of meaning to provide care to others, to improve the patient experience. We need engaged and empowered staff. That requires leadership that recognizes the patients, residents, families, and staff matter. So yes, very good. Thank you. Appreciate that, Hugh. And Rosina says critical care nurses typically work closely with respiratory therapists, which is along with what Noelle was saying. And she goes, wow, a respiratory button. Never heard of that before. That's pretty cool.
I'm going to throw it out there. Cedars-Sinai Medical Center, one of the best places on earth. I was born and raised there as a nurse.
Wow.
And I'm telling you, innovation, it goes all right there.
I love that.
Yeah.
So Rhonda, what about you? Have you heard anything like that, like a respiratory button? And what's your feedback on what Pamela said?
Well, I love what she said. We had a respiratory person assigned to the ER, so we could not do it with all the COVID patients coming in and so many people at first really being intubated, and then we started using more BiPAP, but it was all without them, we couldn't have done it. When I went into one of the ERs that was struggling, the first thing I did is I noticed the ER was standalone. It felt like it was not part of the hospital, but they are. Right. And so I started having meetings with EVS, respiratory, radiology, lab, facility, supply chain, because the ER can't run without all of these units coming together as one. I started inviting the ones that registration and the lab and the people that were in the ER respiratory to our meetings to let them know what we were working on and to see if and to listen to them too, because they are part of the team, and making them feel part of the team is so important. Another thing with ER is the inpatient nurses and the ER team sometimes kind of go at it. They're not taking report. They hang up on me. They put, there's always. And so what I wanted to do, and I reached out to the inpatient units, to the directors, and said, what if during orientation, we let the nurses come down here for a few hours, and I send my nurses up to your floor so that they can see what one another does. I've only worked in the ER. And so I need to understand. So I even went up into ICU and to med surge, because we all have our own challenges, and we need to understand those and respect them, and understand that we are one hospital. We are one. The patients don't come in and go, I'm in the ER now. Oh, now I'm in, ICU, or I'm in radiology. They see it as I'm at this hospital. So we all need to make sure that we are one team. So it's not just a team of the unit, it's a team of the hospital working together.
I love that. Okay, so Casey, you've heard all these comments here. I'd love to get your thoughts. What you guys are doing, what your standpoint is when you think about Pamela's comments and some of the other things that Noelle and Rhonda were just sharing. We can't hear you.
I thought Pamela with her bionic ear could hear me.
That's
I love
a
it.
good one.
I did.
Of course, as I'm dating myself, maybe I'm in a Godzilla movie. But no, I have to agree. I mean, Rhonda, I've heard that, I've done that. What was interesting is I actually did where, a pull model where the nurses go down to the ER and actually get the patient from down there. I did that at the last place I was at. We were about 300 beds and it was very busy. And the nurses, they need to know this. They may not know this. A typical facility, 25, 35% of your people admitted actually come through the emergency room. The facility I'm at now, we're upwards around 50, which is very high for emergency rooms to admit.
Wow.
But again, you sometimes have facilities that are somewhat boutique or special with what they offer, and the physicians, and they have history of it, so they have it. But back to the respiratory, I, like Noelle, CV nurse. So I was very much used to having the respiratory therapist there. We were allowed to back then change the settings of the vents. We document it, give the treatments and all that stuff, but it was in a very close conjunction with respiratory. So I've heard some of the things Pamela said. I've seen some of that. I would just say when I was at the clinical bedside, it was more from the choice of some of the people that worked together. They just didn't seem to fit well together or want to work together. But my experience, and what's interesting, those cookies I showed you, respiratory was one of the departments we took cookies to. And for the respiratory therapists, when I worked in CVICU and trauma ICU, that were both on days and nights, now work over here at this hospital. So I got to go over there and still give them cookies today. And they're like, we're always doing that. But, that was nice. But it is. Any of them are a very critical part of the team. How you respect them, is going to show, kind of like what the whole title is here, what you're doing with your staff, and that's going to rub off on the patients. If you're not kind of building them up when they're in the room with the patient, this is Pamela. She's this awesome RT. All the patients usually love her. You can talk to her, ask her questions. She's very knowledgeable. She's been here for 10 years, and she's been recognized for this. She always gets compliments. Well, the patient's going to say, wow, I got this wonderful RT, but, you're also showing, yes, we're a unified team there, and we're a care team. That's what we do. So that's just a couple of examples that I've had, but I've always been very fortunate. It's only once I think that I have a bad RT. We had a coach, we're trying to get somebody off of the cath lab table to get another cath lab patient in straight from the ER that was having a heart attack, and the RT disappeared. And we're like, well, who's going to move that? I mean, I'm not okay at that facility to do the vent, but I'd done it somewhere else. So I said, okay, well, I'll just run the vent. Let's just get them out of here because we need to get these people here. So Larry's like, oh, we're used to waiting like 30 minutes. So I thought if I just walked away, no, it's a busy situation. You can't, let's go. So that was the only bad example I had. But it goes back to, if people don't think part of the team, follow your process.
Yeah. I love that part about the intro. I think that just that little key, because like if someone comes on the show, like if you guys came on the show and I didn't acknowledge who you were, and I was just like, Rhonda's here, Noelle's here, whatever. You're not as excited about when you come on the show. You're not excited when you're talking. But if I'm pumping you up and I'm glad to see you, I'm smiling, I'm so happy to have you here, it's a different feeling. And I think that same kind of thing, I was imagining that as Casey was expressing that about what, if Pamela's walking in the room, it's like, oh, here's Pamela. She's been here 10 years. She's great. All the patients love her. And then they're like, oh, I'm great. And then going back to Rhonda's point, this is all part of the same hospital. They think of it as a hospital. They don't say, well, this is a great ER unit, but I didn't like the RT unit so much, or I like the ICU better. They're just like, either they had a good experience at the hospital or they didn't. So that was, that was golden. Okay. So we had some more stuff come in too while you were talking here. Rosina says, collaborate across departments and teams. Teamwork makes the dream work. I love that statement. I love teamwork.
I use it all the time.
Hugh says, do we need to stop using language like we are doing this for staff, which often sounds and feels like coming from the top, to asking those who are impacted what needs to change? Yeah. So what are your thoughts on that? Who wants to take that one?
I totally agree with him on that. Because you're using that tone, you're talking at and not with. And when you're talking with, it becomes more of a collaborative interaction.
Yeah, makes sense.
I agree with her. we need to make sure, because a lot of things are pushed down from the top down, and I can't go in and go, hey, corporate wants us to do this now, so we're gonna, I have to sell it and get using the change management, make them feel like it's their ideal, and push it down and have them take it on and take it as their own. Yeah. So we really need to listen to them and ask their opinions and not just push everything down.
Yeah, good point.
Agreed.
What do you think, Pam?
Ronda, that goes back to your point on talking about tier, and how tiers are so useful with having that, for those huddles.
Mm-hmm.
Absolutely.
Yes.
By the way, I didn't ask you this, Casey. How long are those huddles generally?
Well, it depends on how good the director is or manager is running it.
Okay.
And a lot of it's process. So 5-10 minutes is really what the ideal is. You're going over, this is what we have today. Okay, we've got 8 surgeries, we've got 3 CABGs, 2 valves, we have a TAA coming in, da-da-da. We've got, the same people going to be moving out, this, that. Okay, the new thing is we got this for lines, we've got that for lines, da-da. Your survey's coming up, make sure you get that, da-da-da, and you're done. And here's our communication book where all the other stuff is that you can sign off during the day when you have a few minutes, grab the book, take it to the bedside, read through it, this and that, versus I'm going to sit here and I'm going to talk to you. I'm not going to talk with you. I'm going to read this to you because you're in kindergarten. Kind of stuff. Sort of stuff. So that's why I say they're supposed to be quick. Our tier 2 huddle is usually about 30 minutes, but you do cover a whole lot in it. So that's an opportunity where you may have upticks and maybe some patient quality measures that are out of whack. And so that's where you really begin to see an executive team, because you have physicians on there too, gently hold people accountable because you review them in front of everybody. You may have 80 to 90 people on there. Okay, what about this? And how was your audit for this? What was your audit? What did you learn? What did you teach? That sort of stuff. And you go through that. So that may add 10 minutes on, but I guarantee you do that for about 3 weeks and nobody wants to be the one talking. Docs don't want to be the one talking. And so their practice begins to change, and that benefits the patients, sort of stuff. And then usually the executive huddle may be 15, 20 minutes. And that's generally on a giant spreadsheet. There's very targeted data items with actions around it. So you track and trend and actions, and then there's other subsequent meetings that are had that pull on that data. When you look at strategy, when you look at deep dive, what are the core issues here? Have we really gotten to the issue? So that's really how that all rolls up. And I can just say you're here, Rollis, with that freeze, and we had this freeze here in Houston. So, we couldn't use the water for a while. Let me tell you, you've got close to 89 units here, different areas. They all have coffee machines, and trying to get those filters changed out so that the staff and the few visitors that we did have could use those coffee machines. That went on for about 2 weeks, just going through to where we just ended up buying them and going up there doing them ourselves, because the staff, they were just going on and on and on about them, and rightfully so, they want their coffee.
Right.
But it's just an example of how the system, it really does work. You want to be overdone, action plan implemented, there we go. It's 80 degrees. Thanks, guys. We can do it.
Yeah, absolutely. No, I love that. I love this just real life cool, experiences you guys are sharing with folks in our audience and with myself. Pamela, I should say Pam. I'm just going to say Pam because I know you say Pam.
Yeah, that's fine. That's what I normally go by. When I hear Pamela, I usually feel like I'm in trouble or something.
Pamela, what are you doing? So Pam, what's your take on huddles?
We did a huddle as well. We would look at things that we could have an impact on, like absences, productivity, things like that. We looked at press gaining reports, different things, and they were very, very helpful to us. We also would, at the end of the huddle, we would ask if there was anything that anybody had going on that they needed assistance with. Maybe they had a brother that was going in for surgery that day, or maybe they had something going on, and it would give us just a little bit of an idea that, hey, maybe this person's having not the best day. And so we could help them, or it would also be like where they would say, I need to leave like 15 minutes early today. Is there somebody that could take over for me just a little bit early? And it was always just a time for us to know how the day was. We would talk about how much equipment we had out, we only, especially during COVID, well, we've got 4 vents left. We've got this many pieces of equipment left. It would make us look to see, is there any equipment somewhere that's not in use that we could pull, and it made us just a little bit more aware of what we were doing. The other thing that my staff opted to do, which I thought was really wonderful, is at the end of our huddle, my staff opted to pray, which I thought was really nice. We prayed every day. We prayed for the patients. We prayed for the staff. We prayed for, maybe the brother that was going into surgery. And what was really cool about that, it went through the hospital that we prayed every day, and we would get prayer requests. Really? And I thought that was really kind of cool. Like one lady in the cafeteria, I was in there for breakfast, and she said, hey, so-and-so is going in for surgery today. Will you guys pray for them at your huddle? And I was like, absolutely. And it was really bonding for us, because then we felt like we were in it all together.
Yes.
And it was, if they didn't want to pray with us, that was fine too. We didn't make anybody, we didn't force anybody. It was just something that felt natural.
Okay.
After we discussed everything, and we were in a religious facility, so it was really nice.
So it fit the culture.
And, pardon me?
It fit the culture, because you're saying it's a religious place.
Yes, it fit the culture, and like I said, it made everybody feel like a team.
Okay.
We were all in it together.
I think I can see how that could be incredibly cohesive, especially if everyone in the team happens to share the same faith. They would be able to be on the same page on the prayer. I have a question, and I don't want you guys to answer it. I want the audience to guess. Okay, so I want you to tell me, never have I ever. Tell me if this is true of you or not. Never have I ever had an uncontrollable giggling fit at the worst possible moment. Okay, now don't tell me yes or no. Our audience is going to guess whether you've ever had that happen. And to make it really fun, let's do this. Let's say in the past year, okay? So we'll add a little level of difficulty. In the past year, so never have I ever had an uncontrollable giggling fit at the worst possible moment. So those are the comments. I want you to guess. Tell me what you think. And if you want to name specific ones like Noelle, yes, Rhonda, no, you can do that way if you want. Okay. Rosina says, we did that in Canada, St. Paul's, with the medical staff coming to do their rotation at the hospital, follow a nurse for 8 hours to understand what we go through. This improved doctors' attitudes towards nurses tremendously. They had a better appreciation for nurses. This was over 30 years ago, but that was a group of med-surg nurses proposed on our very first shared governance unit. Groundbreaking back then, she said. Interesting. You guys ever done anything like that? Or heard of that?
Mm-hmm. Yeah.
Very cool. Mm-hmm. She says, huddles are great. We did daily huddles at the director, manager, and top leadership level when I managed the education department in California a few years ago. Then another each leader with their department staff. These huddles started our day and lasted 15 to 30 minutes. So these huddles you're talking about, they're every day.
Yes.
Twice a day.
Wow.
For us, we would do it at change of shift in the morning.
15 to 30 seems kind of long though, for some reason.
That's more of like a mini meeting than a huddle, because the whole point is to really acknowledge, keep people aware. What are your, you really want to look at, what are the safety concerns? You have all the tools and resources you need to do your job today. Here are the few updates. Any concerns? Great. People ask their questions, reset, next shift starts. It sets the tone for the day. I mean, when you want to set a precedence, you set it at that morning huddle, and then the charge nurses naturally resume that independence and will do a night huddle at change of shift at night.
Well, thank you. I appreciate that feedback. Thank you, Rosina, for putting that in there. Really appreciate all your wonderful comments. Those are the comments. If you're watching the replay or watching live, I want you to guess before they give the answer. do you think that either one of them had an uncontrollable giggling fit at the worst possible moment within the past year? Okay. All right. Let's start off with you, Casey. So what would you say? Never have I ever had an uncontrollable fit at the worst possible moment. Have you had that happen in the past year?
I'm not sure if it's worst possible or inappropriate. You're laughing at the person you're working with, not so much the situation or what you're doing. It's generally their reaction to it. So I don't want you to think, oh, you're laughing at some patient like you're making fun of them. No, it's usually this reaction this other person has or whatever they're doing.
Right.
Stop. It's hysterical.
Yeah. Yeah. Okay. Very good. And then, so Pamela, what about you?
Yes, I did. I know that's hard to believe, but I was cutting up with one of my staff members, and we each had the giggles, and my personal cell phone rang, and I was giggling so hard, and I don't know why I answered the phone, but I did, and it was a recruiter for a job, and I couldn't stop laughing.
That's amazing.
And I was like, try to hang on to this, but I just kept giggling. But the great thing about it is I told her that we were practicing laugh therapy.
Yes.
Because we were having a bad morning, and I said, I'm practicing laugh therapy. And the great thing that happened about that is later that afternoon, she sent me an email and said, thank you for starting my day off with some laughter, because I laughed all day.
That's awesome.
Thinking about that. And so I'm in second interviews.
That's awesome. That's a great story.
I love it.
Awesome.
Yeah, I should have had my applause ready faster here, but yeah, that was awesome. There you go. So I still got you right. That was great. So Rosina gave a follow-up. She said, I think she explained why it was so long. She said it included all departments, including plant services, environmental, all nursing departments.
Oh, I know what she's talking about.
Oh, yeah, that's a different huddle than what I was discussing.
She said they really worked. Each department leader had 3 minutes to report issues or plan for the day.
Yes.
Yes.
Yeah, so that makes sense. Thank you, Rosina. Appreciate that follow-up. Okay, that was cool. All right, so getting back to our subject here, we got to wrap up here in a few minutes, so I want to make sure we cover everything we said we're going to cover. We're going to talk about pulling the team together. So any ideas on pulling the team together? Who wants to start with that one first?
I have an idea that what I did for pulling the team together was a peanut butter and jelly drive. And we challenged the hospital to a peanut butter and jelly drive. And it really pulled our team together. We did it in April to be done in May, and to donate that to the food banks, to the local food banks. And it was amazing how many people throughout the hospital donated to that. And we were so successful that the great thing about it is when the place came to pick up the peanut butter and jelly, they said all of their cupboards were bare. They had no peanut butter and jelly. And it just worked out perfectly. We picked peanut butter and jelly because, you can buy a jar of peanut butter for $1, and so if you want to give, it didn't make it so that it was hard for everyone to give. Anybody could give if they wanted to. And it really brought my team together because they would look at the mounds of peanut butter and jelly that we had, and they were so proud of themselves. And the local paper came, took pictures of it. The corporate took pictures of it, put it in our corporate newspaper. And so my staff got a lot of accolades about it, but it really brought them together feeling good about doing something and giving back to the community.
I love that.
That's awesome. Pam, I got 2 things I have for you. One, you are a remarkable human being, and anyone to have you is going to be an incredible asset. And 2, where on God's earth do you live where peanut butter is only $1? On my side of town, it's about $8, $9.
I'm in Kentucky. I mean,
All right, that says so much. In Boston, you are not buying peanut butter for $1.
Yeah, I tell you.
well, but our cost of living is probably a lot less than yours.
It
Yeah.
absolutely is. But you are a remarkable human being. What a great leader you are. I love your
Oh, thank you.
Yeah.
That's awesome.
You guys should
Thank you
follow
very
her video, her profile, because she's got like a whole series of videos on stuff she did on employee engagement with her staff. It was really cool. Really cool
I
ideas.
cannot wait to stalk you out on LinkedIn. You're going to be like my new Netflix now.
Oh, thank you so much. No, I enjoy doing it because, I want somebody to give me ideas. I come up with ideas. They're inspired by different things. And, I need some more inspiration so that when I do get a new staff, I have new, fresh ideas to go along with everything. But thank you so much, Noelle.
Well,
That was
I look forward to
really
connecting with you.
Yeah, absolutely. Okay, so we're heading towards the end here, and I want to make sure we get to our last thoughts in. So, any last thoughts you'd like to share? Let's say, Rhonda, how about you? Any last thoughts you'd like to share with our group today?
Thank you so much for having me. I was nervous. I've never done one of these. So thank you all for being so welcoming.
You did a great job.
To me, patients' experience is so important. Every day I go home, that is what I take home with me is I go to bed feeling good because I know I touched someone's life, whether it's my patients, my employees. I know that what I do is working. Since I am looking for a job, I had someone call and go, do you want to go back to school? And I went, no, I have my master's, I'm good. And they'll go, oh, but what would you like to do? And I went, I'm doing what I love to do. Oh, but don't you want to be a lawyer or an IT? Or, oh, no. I want to be exactly where I am, touching lives of the nurses and the patients that entrust their lives to us. So thank you for doing this. It's so important. We'll never get our patient experience up until we can make sure that our employees feel valued and loved and that they enjoy coming to work. So thank you for this.
I love that. And whoever has called you and asked you to leave the profession, we need to take their phone away from them. Take their phone privileges away.
They're trying to get me to go back to school for something else. I'm like, no.
Yeah. Okay. All right. So, Noelle, any last thoughts?
I would just say it really goes back to a team and a self-reflection of who we are as individuals. And if we're not getting the outcomes we're looking to achieve with our patients and families, we really have to do a direct reflection back as, what is it about me and what is it about my team where we're not meeting the needs of our patients? Because no matter the complexity of the patients, as difficult as the patients are, they've got a lot more going on in their lives than we can ever imagine. And we have to be able to take a step back and say, what can we do differently in our thought and our execution of our messages to make that change? And it's self-reflection, team reflection, and take that time out because it's all about the team. And if your team's not performing, the patient's outcomes are going to be the same.
Very good. And you want to take us out here, Casey?
I have to agree with what Noelle said. A lot of it is a reflection of you and how you're interacting with them. And just as Rhonda said, you're here, you're caring for your community. So care for your staff like you care for your community. And they will get the quality of care that they deserve. You'll have happy staff. And what's wonderful, Rhonda, is actually when you're actually able to give your staff the opportunity to go back to school, grow, and guess what? Then they become your manager, somebody else.
Yes.
And then they're actually able to take that and go somewhere else. So that's always very, very helpful. Because they're spreading that to the community. And everybody's
Absolutely. And by the way, Rhonda Rosina says, thank you, Rhonda. You have been great. So you have her seal of approval from Dr. Rosina Malaska. And Joanne says, great show today. She thanks all of you. So I want to thank all of you. And those who are watching either live or the replay, let us know what resonated with you. What actionable items do you think you're going to take from today's session, or what gave you some encouragement? Or if you have any other questions, feel free and connect with any of the folks. We have everyone tagged. If you're on LinkedIn, everyone's tagged on here. So if you're not on LinkedIn, feel free and go to LinkedIn and watch it here. And you can see the folks who are tagged. Follow them, connect with them, whatever you can do to connect with these folks. They're great folks to follow. But thank you for being on the show every day today, and thank you for your time. Thanks for all you do for healthcare, and happy Nurses Week to everyone.
Happy Nurses Week.
Okay, 1 second. Hang on 1 second before I hit the end button here. By the way, Rosina says everyone was great. Loved Pam's stories too. She added that. Jonathan, you'll let me know when I can hit the end button?
You're good, Rollis.
All right. Thank you, sir.